was constantly worried. I'm thinking, is this going to kill me?
My greatest fear was maybe she had a brain tumor.
I thought that eventually she would die.
It's very difficult to see your child sick and you don't know what's wrong with them.
When a family member has a sickness, we just rally together around that person.
I was definitely frightened. I really wanted to know, what did I have?
Next, two medical mysteries that defied the experts. For 12 years, Jane Strauss is tormented by double vision, loss of balance, bizarre hallucinations, and non-stop diarrhea. But try as they might, doctors can't seem to see a pattern in her baffling constellation of symptoms.
Picture the worst stomach virus you ever had, and then imagine having it 7 days a week.
Then, LaShawn Davis suffers from spiking fevers, sweats, shortness of breath, and extreme weakness. No one can figure out what's wrong with her, but it's clear that this mysterious condition could have deadly consequences.
I was worried that I was not going to be around to see my daughter get older.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. "52-year-old Jane Strauss is a wife and mother. For years, she has worked in the bakery industry as a sales analyst and has always taken care of herself.
I was a relatively healthy person. I was allergic to dairy products, so I had to always avoid dairy products. If I did that, I was okay.
Jane monitors her diet carefully and for the most part remains symptom-free. But in the mid-1990s, something begins to change.
I had stomach pain, cramping, diarrhea. Everything that I ate went right through me. Picture the worst stomach virus you ever had, and then imagine having it 7 days a week.
The mornings were really the worst. She would go in the bathroom, I don't know, 6, 7 times in the morning. I felt really bad for her, this is ridiculous.
After nearly 1 month with no let-up, Jane gets a referral to a gastroenterologist for testing. Over the next 6 months, she undergoes a series of tests, including an upper GI series and a colonoscopy, but all the results come back negative.
When they couldn't find anything physically wrong with me, they said to me that it's irritable bowel syndrome, which is like a spastic colon, very common.
Irritable bowel syndrome, or IBS, is a disorder that affects 1 in 5 Americans. The term is a catch-all for a variety of chronic bowel problems.
I didn't think it was really serious. I just thought that she had this stomach problem and some doctor needs to find out how to help her.
On her doctor's recommendation, Jane tries a variety of over-the-counter remedies, but nothing seems to provide much relief.
The fiber that they told me to take didn't work. I tried the lactose pills, that didn't work. Really nothing that I tried worked.
She was okay for maybe a day, and then the next day it was all over again. It just was an ongoing problem that nobody could solve.
I found it hard to believe that other people are living like this, and that there's nothing that they really can do about it.
It's not long before Jane's diarrhea begins to affect how she works and lives.
My whole day was designed around bodily functions. I'd get up 2 hours earlier in the morning to make sure that I was okay before I went to work. I would leave the house, and no sooner that I got in my car, sometimes didn't even put the keys in the ignition, I was running back in the house. And this would just happen sometimes 3 times in a morning.
On her drive into work, it often happens again, forcing her to stop wherever she can along the road.
I learned to avoid highways because there's no place to stop, so I would take back roads to work. I know every restroom on my route to work, gas stations, you name it, diners. As a matter of fact, I know every restroom everywhere I go.
Embarrassed, Jane does her best to keep her condition to herself, but eventually her friends start to notice her unusual eating habits.
When we would have lunch together, I noticed that she always ate like crackers or Chex Mix. She never ate like a meal. So one day I said, Jane, do you always eat like this?
Oh, I was constantly worried. I didn't want to eat. If I was feeling good, I was afraid that I would eat, and then the cycle would start all over again. I probably lost 15 to 20 pounds. I started to not want to go out to restaurants. Let's face it, this is embarrassing. It's embarrassing to go out to eat with somebody and spend 20 minutes in the bathroom. I dreaded when there was a company function and there was lunch being served and we all went out to eat. I wanted to make sure that there was a restroom, adequate restroom close by. I mean, my God, what if there's only one stall? What do I do then?
Then one day, sick of being too scared to eat, Jane decides to join her coworkers at a birthday lunch for Kim.
I was feeling pretty good that morning, so of course I went along. She's my friend, it was her birthday.
We started to eat our appetizers, and Jane excused herself from the table.
I had to dash to the restroom. I came out, and I had to run back in again.
And this went on for quite some time, 5 or 6 times, until the point where she could not eat her meal.
I was mortified. At this point in time, I'm thinking, I can't eat anything. I'm never going to go out to lunch again.
It's clear now that Jane's chronic diarrhea is beginning to take over her life. She checks in with her doctor about her continuing problem, but the doctor maintains that her symptoms are typical of IBS.
I felt that this is a diagnosis that they give you when they really don't know what else it is. I couldn't believe that anybody could even function like this. In the back of my mind, I always thought that it was something more serious, but I just resigned myself to, well, they can't find anything wrong. They don't know what it is, so I guess I just have to live with this.
But then one day, Jane starts to experience a bizarre new symptom.
My hands started to become really cold, and I had numbness like in the fingertips, tingling in the fingertips, kind of felt like ants crawling across your skin. And then I developed the same set of symptoms in my feet.
Jane takes notice of these changes but doesn't give them too much thought until another alarming condition begins to develop: double vision.
I'd be looking at something and all of a sudden I'd have to do a double take because I would see 2 items instead of 1. I thought, what in the world is going on? When I was putting on my makeup in the morning, I would see, 4 eyes instead of 2 eyes. I was scared because I'm driving to work and I'm seeing double.
For 3 years, Jane Strauss has suffered from uncontrollable diarrhea, which she's been told is simply garden variety irritable bowel syndrome. But when she starts feeling tingling in her feet and hands and experiencing double vision, she immediately makes an appointment with an eye doctor.
The eye doctor noticed some dryness in my eyes and gave me eye drops and an allergy drop, thinking that maybe this was seasonal allergy related.
Jane never suffered from seasonal allergies before, but takes the doctor's advice and uses the drops. They don't help. In fact, her vision problems get worse.
There were times when if I were sitting and I bent my head down like this, I would see smoke or steam coming from the floor. I thought I was hallucinating.
I mean, that really freaked me out. I mean, that's really weird stuff.
And then Jane starts to experience another alarming symptom.
I noticed that when I was in the shower, if I closed my eyes when I was shampooing my hair, I would have to grab hold of the shower curtain because I would lose my balance. I felt like I was going to fall over. I thought it was like some type of vertigo or something.
Over the next few months, Jane visits doctor after doctor and undergoes dozens of tests.
I was referred to a neuro-ophthalmologist. I went there and everything was ruled out. There wasn't any problem with my eyes. I also went to an ears, nose, and throat specialist who ruled out any problem with my inner ear. And the only thing that left was, the brain.
Now Jane has a feeling that there's something really wrong with her. Though she's terrified of what she might find out, she makes an appointment with a neurologist.
He made her stand up on one foot, and she just immediately fell over to the right. He wanted her to close her eyes and touch her nose with her finger. She couldn't do that. So we knew there was some kind of problem there.
He saw that I had a balance issue, but he really couldn't explain to me why. I was concerned that I couldn't touch my nose. I was concerned that if I closed my eyes, I was falling over, but he really didn't seem concerned. I really felt like his attitude was, it was all in my head. He really gave me the impression that he felt I was a hypochondriac.
If you can't stand on one foot and you're falling over, or you can't close your eyes and touch your nose, then you're not a hypochondriac. There's something wrong.
It was very frustrating for her to go through these tests and procedures, and nobody seemed to be able to find anything wrong with her. She would say to me things like, "I can't live like this." I was scared for her.
Over the next few months, Jane's symptoms keep progressing, and she visits the neurologist regularly. But while she is sent for more and more tests, they all come back inconclusive.
I was scared. I felt like this is something I probably have to accept. I felt like this is a handicap and a curse.
Then, one evening as she is preparing dinner for her family, something terrifying happens.
I had a bottle of barbecue sauce on the counter. I saw the label on the bottle, like zigzagging and dancing, and I couldn't believe it. I did like a double take, and it was still doing that.
Frantic, Jane calls Bob at work to tell him what's happening. He immediately rushes home to take her to the ER.
By the time we got to the hospital, my vision had gone dim, and then it finally went black.
She said, "I can't see." And I said, "What do you mean? You can't see what?" She said, "I can't see." But that's a scary thing to hear your wife say, "I can't see."
I was just frantic. I didn't know what was going on. Was I having a stroke? I didn't know.
Then, after about 30 minutes of total blindness, Jane's vision begins to return, as mysteriously as it went away. From what Jane has described, doctors in the ER think she may have a detached retina.
And they told me that I should go straight to the emergency room at the local eye hospital.
For the next 4 hours, Jane undergoes more tests. The doctors discover that her retina is intact, but they suspect she has suffered an ocular migraine, a type of migraine that is usually painless, but can severely alter your vision. Treatment is recommended if they are frequent and disabling.
They wouldn't give me any medicine. I thought, oh my God, what if I'm driving and all of a sudden my vision goes black? What do I do then? Basically, the doctor said, well, you pull over. That's what he told me.
My greatest fear was maybe she had a brain tumor or something like that. I didn't want to say that to her. But that's what I thought.
For the last 5 years, Jane Strauss has been suffering from a host of seemingly unrelated ailments, and no doctor can tell her what is wrong.
So here I am thinking, I can't eat anything. I'm having numbness and tingling. I'm having double vision. I'm seeing smoke and steam when I bend my head down. I can't close my eyes in the shower without falling over. This is insane.
For the next 6 years, Jane continues to see doctors, none of whom can get to the bottom of her problems.
I knew something was wrong, and it was pretty frustrating to go from doctor to doctor to doctor for varied symptoms and not be able to find out exactly what was going on.
Jane copes as best she can, but as the years drag on, the struggle begins to take its toll.
She was always frustrated with the doctors because she kept coming to dead roads all the time. It's tough to watch somebody try to get better and they can't. After she had test after test after test and nobody found anything, she was starting to give up.
When it's a beautiful day out, and you should be feeling great, and you should be enjoying this day, there's just something off because you just don't feel right. I felt like I couldn't enjoy life anymore. I felt frustrated, disgusted, and I was really afraid that, something else is going on. I was always waiting, like, what's going to happen to me next? Is this going to kill me?
I just feared one day that Jane wouldn't come to work. I thought that eventually it would just eat her away and she would die.
In 2006, after dealing with these symptoms for over 10 years, Jane is at her wit's end and doesn't know where to turn. But then one night, while watching TV, she comes across a program that would change her life.
I was watching Mystery Diagnosis, and when I watched the show, I thought, you know what, I'm going to go and see this doctor.
Jane calls Dr. Carolyn O'Connor, the rheumatologist featured in the episode, and sets up an appointment.
Jane came to me because she thought I was an expert, and so that I was under the gun.
Jane is hopeful that Dr. O'Connor will be able to see a pattern in all the strange ailments.
She asked me a lot of questions, especially about when I first got sick.
Her gastroenterologist had done numerous tests, and he diagnosed her as having irritable bowel syndrome. Her neurologist also had done a variety of tests, but no diagnosis had been established. She also told me that she had blurriness of vision, and she had been diagnosed as having migraines. The neurologic and the GI symptoms were unexplained. I thought that irritable bowel syndrome is not the right diagnosis. I was particularly struck by the balance problem that she had, so I decided to investigate that first.
Dr. O'Connor decides to perform what's called a Romberg's test, which measures a person's balance. An abnormal result can be an indication of problems with the central nervous system.
We have the patient stand up with their feet about 2 inches apart, and then we have them close their eyes.
Jane is fine when she stands with her eyes open, but the second she closes her eyes, she immediately falls to her side.
Dr. O'Connor saw that I did have some balance issues, and she suspected something.
Dr. O'Connor now has a hunch about what's wrong with Jane, because there are only a few things that can affect a person's balance like this. She thinks the problem could lie in her spinal cord, and that it could be as simple as a vitamin deficiency.
B12 deficiency affects the part of the spinal cord which affects balance. When your B12 level is low, you can experience pins and needles in your feet and in your hands. You can experience diarrhea. You can also experience problems with your balance.
Dr. O'Connor decides to check Jane's B12 level. And when her results come back from the hematologist, she is shocked.
Jane's B12 level came back at a 200. Normal level should be 400 and greater. She had a vitamin B12 deficiency, which was explaining most of her symptoms, if not all. My next job was to find out why Jane had the B12 deficiency.
Jane Strauss has just been diagnosed with a vitamin B12 deficiency, which has been causing over 10 years worth of chronic diarrhea, tingling in her extremities, and balance and vision problems. But the real mystery remains unsolved. What is causing the vitamin B12 deficiency? Her rheumatologist, Dr. Carolyn O'Connor, is determined to figure out the answer.
She told me that she wanted to do some further testing.
One possible explanation is she's not taking enough in her diet, and I determined that she was eating enough animal proteins to give her adequate amounts of vitamin B12. The second possible explanation is if she'd had stomach surgery, which would remove the part of your intestine which allows for B12 to be absorbed. And Jane hadn't had any surgery.
Dr. O'Connor now fears that Jane may actually have another, even rarer disease. She orders more blood work, and when the results come back, her suspicions are confirmed.
I knew Jane had pernicious anemia.
Pernicious anemia is a disorder that occurs when the body lacks something called intrinsic factor, a substance produced in the lining of the stomach that is critical for vitamin B12 to be absorbed. Without intrinsic factor, no vitamin B12 can make it into your bloodstream, and your central nervous and gastrointestinal systems, which are dependent on B12 for healthy function, start falling apart.
When you don't have vitamin B12, many of the cells in the body are affected. And some of those cells are in the nervous system, and some of those cells are in the gastrointestinal tract.
I finally had an answer for why I had double vision, why I had ocular migraines, why I had balance problems, why I had such severe gastric problems. I was ecstatic because I felt like, oh my God, finally my suspicion that everything was related is correct. And finally there's something that they could do.
Dr. O'Connor tells Jane that the treatment for pernicious anemia is vitamin B12 supplements. But because Jane's intestines are not able to absorb B12, taking supplements by mouth will not work. Instead, she'll need injections for the rest of her life. Jane starts treatment right away, and just 2 days later begins to notice a difference.
Immediately, her stomach started to get better. She said to me, "Oh, I'm so happy that my stomach is better. I'm not as tired. I don't have the bloating that I had. I'm not going to the bathroom 20 times a day."
Jane is thrilled to have her life back, but she's even more relieved that a diagnosis was finally made. Approximately 1 in 4,000 people are diagnosed each year, but doctors suspect that the real number of sufferers is much higher. And if left untreated, pernicious anemia can be deadly.
Undiagnosed B12 deficiency can lead to irreversible brain damage or even blindness. She could have severe mental dysfunction resulting in dementia and confusion. Worst case scenario, Jane could have had severe anemia resulting in heart failure.
Jane's prognosis is now good, but she and her family still wonder why it took so many years for a doctor to catch on.
My opinion is if she had the proper doctors when all this stuff started, then maybe she could have got a lot of help.
The most frustrating thing is that no one listened to me. It's been 12 years that I've suffered through all of this.
But there was one very common symptom of the disease she didn't have: anemia, or low iron. Had she presented with that, her diagnosis may have come earlier.
10 to 20% of patients with pernicious anemia will not have the anemia at first. They will only have the neurologic symptoms. In those cases, the doctor won't think of pernicious anemia.
Jane's age at the time her symptoms first set in may also have thrown doctors off the trail.
B12 deficiency is not that common in patients of Jane's age. Jane is only 52 and her symptoms started in her late 30s. So the doctors wouldn't necessarily think low vitamin B12 because she was so young.
Today, just 6 months after being diagnosed, Jane feels like she has her life back in control.
I feel like a normal person again. Most of my symptoms have cleared up. I may still have some neurological symptoms that'll be irreversible. The balance problems may never go away.
She is better, but you worry about it, you can't help it. We ain't getting any younger.
I've seen tremendous change in Jane to the point where I can walk by her office and she's eating a hoagie, something she would never do before.
Jane now believes that her experience can serve as an important lesson to others caught in the downward spiral of misdiagnosis.
Just because somebody has a jacket on that says doctor, does that mean that they know more than you as far as how you feel? I think that if you're not happy with the doctor, if you feel that the doctor's dismissive or the doctor's not listening to you, leave.
Go find a doctor that's going to say, this is what's wrong with you. You might not like what you hear, but at least you'll know what it is and it can be treated.
Through the course of her illness, only Jane's closest friends and family knew that she was suffering. But when LaShawn Davis started to get sick, the terrifying symptoms were obvious to everyone. In 2000, 31-year-old LaShawn Davis was living outside Washington, D.C., working for the federal government. She was healthy, driven, and always very outgoing.
I was basically a workaholic. I did a lot of running around. I used to work out 3 days a week.
She's a go-getter. She's outgoing, very active.
And in the summer of that year, LaShawn and her family are thrilled to discover that she's pregnant with her first child.
I was feeling pretty good the first 2 trimesters. The last one started to be a struggle.
Like many pregnant women, LaShawn begins to feel extremely fatigued.
It was just difficult to walk, to get from point A to point B. I was always out of breath.
She slows down a bit, and then she catches a cold. Not much to worry about, she figures, but then suddenly, one day, she loses her voice. And 3 weeks later, it hasn't returned.
I went to the doctor, but unfortunately, they weren't able to treat it very well because of the pregnancy. They gave me different things to use, like cough drops and different sprays and stuff like that, but it didn't actually help.
Over the next few weeks, as her cold refuses to go away, LaShawn does her best to cope with her growing fatigue. She takes what over-the-counter medication she can and tries to stay upbeat. But then, in the 6th month of her pregnancy, a new and bizarre symptom develops.
One morning I woke up and I was just soaking wet. I just completely sweat the top and bottom of the sheets.
We just assumed that if she was sweating, she had a cold.
When I went to bed, I felt normal temperature, but in waking up, I was completely saturated. I would have these sweats at least every other night. I didn't feel like it was normal, but I really didn't know.
LaShawn checks in with her doctor about her symptoms, but he assures her that they're likely all related to the pregnancy. It seems to make sense to LaShawn, but then one change she was expecting while she's pregnant doesn't happen.
During her pregnancy, she didn't gain a lot of weight. We were worried about that.
I was extremely surprised that I didn't gain any weight. I had lost several pounds the year before, so I had anticipated during the pregnancy that I would gain at least 20 pounds, but I didn't.
LaShawn checks in with her doctor again, but is assured that the baby is developing normally and that not all pregnant women gain a lot of weight.
Everything was fine. They weren't really concerned with it.
The weeks go by, and LaShawn turns her focus as best she can on preparations for the new addition to the family. Then, 3 days before her due date, LaShawn begins to feel contractions. Her parents immediately kick into high gear.
And my mother just told her to get dressed. They were taking her to the hospital. She's probably going into labor.
They head to the emergency room, but the family is completely unprepared for what they hear next. After a quick examination, doctors inform LaShawn that her baby is in distress. She's dehydrated and needs oxygen fast.
It was very serious. She was supposed to have natural childbirth, and the doctor was on the way, but once they hooked her up to the monitors and they were losing the baby's heartbeat, and my sister's breathing was off, and I guess her oxygen level was dropping. And they had to do emergency C-section because they were going to lose both of them.
LaShawn gives birth to a healthy baby girl named Sydney. Mother and baby seem to be doing fine, but then a few days later, just as LaShawn is getting ready to be discharged, something scary happens.
Her temperature would go up very high, then it would go down, and then maybe it'll stay down for an hour or two, and then it'll spike back up.
High fevers in women who have just given birth can indicate a potentially dangerous infection.
They immediately tell me that I can't leave. The baby was given a clean bill of health, but I wasn't.
What was supposed to be a routine delivery turns into a nightmare. Over the next week, doctors discover that many of the symptoms LaShawn had while pregnant, fever, sweats, and fatigue, have returned, and they don't know why.
They're just constantly running tests, so they were actually looking for something definitive.
While the tests come back inconclusive, doctors discover that LaShawn's white blood cell count is high, indicating inflammation or infection somewhere. For the next few days, LaShawn's fevers continue to spike 102 and 103 degrees, and her oxygen levels remain low. X-rays of LaShawn's lungs show scarring, which could mean any number of problems. So the doctors decide to perform a biopsy of her lung to see what they can find.
I really was concerned about what was going on.
The procedure goes smoothly, but just as she is being wheeled out of the operating room, her vital signs go haywire, and she's rushed into intensive care.
Most of the time when you're in intensive care, you don't know if it's life or death.
Just days after giving birth to a healthy baby girl, LaShawn Davis finds herself in the ICU, suffering from high fevers, sweats, low oxygen levels, and a high white blood cell count, indicating a possible infection or some sort of inflammation.
They were running tests, and nobody could give an answer to what was wrong with her.
It was extreme. I really wanted to know, what did I have?
But despite the medical team's best efforts, they can't figure out what's making LaShawn so sick. Eventually, they begin administering doses of prednisone, a steroid designed to reduce symptoms associated with inflammation. She stays in the hospital for another 2 weeks, and during that time, she does seem to respond to the treatment. Finally, 1 month after delivering her baby, LaShawn is allowed to go home.
I'm very frustrated that I've ran all these tests, that I've been in the hospital all this time, and they're not able to determine anything.
As instructed, LaShawn continues taking the prednisone, but the drug is known to cause severe side effects, such as swelling of the face, weight gain, and irritability. So after a few more weeks, the doctor begins to decrease her dosage. But as soon as she tapers off the medication, her symptoms return with a vengeance.
I'm having the fevers and the sweats. I'm having a lot of swelling in the ankles. Physically, I'm feeling really weak. I'm not able to lift the baby. I'm moving slower than I've ever moved before.
Finally, the results from LaShawn's lung biopsy come back with a partial diagnosis. They show she has interstitial lung disease, a nonspecific lung disorder which can cause scarring of the lungs and difficulty breathing. But it's still unclear what's triggering the condition. She's immediately referred to a pulmonologist for follow-up.
I start seeing a pulmonary doctor once every 2 weeks. They're doing pulmonary function tests to determine how much oxygen I'm actually getting in and how much I can actually push out. My ability to do that is gradually decreasing.
But the doctor can't figure out why. As the testing continues, LaShawn's maternity leave runs out, and the exhausted new mother is forced to return to work.
It felt draining just to get from point A to point B. I was a walker. I was used to walking very swiftly, and now I was completely wiped out just getting to work. I could not get from the elevator down the hall to my office without stopping a couple times.
Then, one day, as she's leaving the office, LaShawn's profound sense of fatigue takes a terrifying turn for the worse.
I get back to my car, and I go to crank the car, and I can't get enough strength to crank it. I wait a few minutes, and I try it again. But each time that I try to do it, my wrist is getting weaker and weaker. And so I wait a few more minutes, and I still can't crank it. I'm completely frustrated. I'm crying. I don't understand why I can't crank this car. I knew something was really wrong then.
Finally, drawing on every ounce of strength she can muster, LaShawn manages to start the car.
My thoughts were that I needed to call the doctor. I needed to find out if there was any other tests that we could run. What else could we do?
When LaShawn checks in with her doctor, she tells him that the pain and weakness seem to be in her wrist. So the pulmonologist refers her to a rheumatologist, a doctor who deals with joint problems. The rheumatologist orders an electromyogram, a procedure that measures muscle function by stimulating muscles with electrified needles. A positive reading will indicate muscle or nerve damage.
Those particular tests did come back fine. And so, unfortunately, they're sort of at wit's end trying to figure out exactly what it is. There was nothing that I could do.
And as the weeks go by, the weakness she's experiencing continues to get worse.
Because of the weakness in my hands and my wrists, I'm not able to do things that we take for granted, that are everyday things, like open a soda bottle, open a jar. I'd have to wait for someone else to come home to actually open stuff for me.
LaShawn is forced to rely on her family for help with just about everything.
It was very difficult to do long walks, shopping, going to the grocery store. I usually had someone do it for me. I definitely needed assistance in putting on my socks and tying my shoes. All of the ordinary things that people wouldn't think that you would need help with, I needed help with.
It's hard to see someone that you know was always active and then you can't do any of that. We did everything we possibly could to help her.
She had a lot of family support. When a family member has a sickness, we just rally together around that person.
As the weeks drag on, it gradually becomes more and more difficult for LaShawn to move at all.
Sometimes I just could not get up. I just could not do it.
LaShawn Davis has spent months coping with shortness of breath, swollen hands and wrists, and extreme weakness. She has undergone numerous tests to try to determine why she has a high white blood cell count and what is causing her to feel so awful. But all the results come back inconclusive.
I took her to the doctor more times than I got fingers and toes.
After about 6 months of running various tests and coming up with different lab work, I was concerned that my condition was worsening.
Determined to find out what is going on once and for all, LaShawn changes her insurance and schedules an appointment with a new pulmonologist for a second opinion.
He knew that I was having difficulties breathing, but he also knew that I had extreme swelling in my hands, my wrists, and the different symptoms as far as not being able to open stuff and the bending down or the getting up.
The doctor decides to put her back on the steroid prednisone to see if that will help with her inflammatory symptoms. He also refers her to his colleague, Dr. Lisa Christopher Stein, a rheumatologist.
I had been looking at LaShawn's chart and reviewing the data that was available to me. She seemed like one of the sickest patients, that's certainly on paper, that I had seen in a while.
I think my numbers were just something that she had never seen before.
She had an extremely elevated white blood cell count that I could not justify. It was about 4 times the usual level. On average, we say about 5 to 10,000 is the count. Hers were as high at times as 30,000.
Dr. Christopher Stein knows a high white blood cell count can be an indication of a variety of serious conditions, including infections and cancer. So she orders a biopsy of LaShawn's lymph nodes to see what she can find out.
The first time I heard that it could be cancer, I was concerned because I had an infant. I was worried that I was not going to be around to see my daughter get older.
A few days later, the biopsy comes back negative for cancer, and LaShawn is relieved that the doctors can rule that out. But further blood tests do show something interesting. She has elevated CPK, an enzyme found in the heart, brain, and muscles, which could be an indication of muscle damage and possibly inflammation.
When muscles are irritated or inflamed, they can leak the chemicals like enzymes into the bloodstream in higher levels than are normally found there. That was what happened in LaShawn's case. A normal CPK on average is somewhere between 100 and 200 or 250. LaShawn's numbers were around 1,500.
Dr. Christopher Stein is determined to find out why LaShawn's muscles are leaking this enzyme. She immediately orders an MRI of LaShawn's thigh muscle.
After the MRI showed that there was some inflammation in her muscles, we used that to guide us to biopsy those muscles. After looking at her muscle tissue under the microscope, it showed evidence that her muscles were indeed being attacked by her own immune system. The combination of interstitial lung disease, weakness with elevated muscle enzymes, and a positive muscle biopsy, in combination with the antibodies we saw, led us to the diagnosis of polymyositis.
Polymyositis is a rare autoimmune disease that occurs when white blood cells spontaneously invade muscle tissue, and in some cases, lung tissue. The affected tissue becomes inflamed and stops functioning properly. Its cause is not known, and about 50,000 people in the United States suffer from some form of myositis. About 30% of those people will have lung disease as well.
Polymyositis literally means many muscles inflamed. In LaShawn's case, not only does her immune system recognize her muscles as foreign, it recognizes her own lungs as foreign. Why this occurs is a mystery to all doctors.
I was relieved to know exactly what it was, because then it meant an opportunity to see how to at least deal with it.
There is currently no cure for the condition, but it can be managed. LaShawn is prescribed the drugs Imuran and methotrexate to suppress her overactive immune system. And because of her particular illness, it is likely she will need the medication for the rest of her life.
With the medicine, I'm able to get from point A to point B without it being as much of a hardship. I'm able to get up out of a seated position on my own. I don't have to worry about whether I can start the car or not.
LaShawn is forever grateful to Dr. Christopher Stein for finally identifying her condition. Unfortunately, the disease can be difficult to pinpoint.
The symptoms can be so nonspecific initially, and then patients themselves sometimes don't recognize that they're getting weaker, or they do and they blame it on a host of other things.
One thing's for sure, LaShawn is lucky she was diagnosed when she was.
This disease can be fatal because the lungs continue to be inflamed, scar further, impair your ability to get oxygen to the tissues, and without oxygen, we die.
No one knows for sure, but doctors suspect that the flu-like symptoms LaShawn experienced during her pregnancy, fatigue, weakness, sweats, a lingering cold, and laryngitis, may have been the first warning signs.
In LaShawn's case, I suspect that she was at risk for some perhaps genetic background that we are unable to know more about at this point in time. And then there was a second trigger, whether it was a virus, whether it was her pregnancy, whether it was anything in the environment, I cannot say for sure.
Oh, you've got all the short pages, and I have all the long. Is that what's going on? Look. OMG.
Today, 5 years after being diagnosed, LaShawn is still adjusting to a slower lifestyle.
My condition right now is I'm pretty stable. I have to try not to overexert myself.
We've talked about the possibility of a lung transplant, but to date she's been able to avoid that, and I'm hopeful that we can continue to treat the disease, suppress her symptoms, and hopefully avoid that in the future.
She tries to live as a normal life as possible. She does have oxygen at home, so when her levels do drop, she can get on the oxygen. Her daughter's getting older, so she's able to help her. To me, she's doing much better.
It's very difficult to see your child sick and you don't know what's wrong with them. But then, when they're better, you just have faith that God has came through.
I have good days and I have bad days, but I'm definitely more functional than I've ever been. This whole experience has given me a new value on life itself and how precious it is.